Welcome to Beat Cancer, the official podcast of the UC Davis Comprehensive Cancer Center. Thanks for joining us today as we have in-depth discussions of the science, research, and advancements taking place at our National Cancer Institute designated Comprehensive Cancer Center. I'm Chris Joyce, and today we'll be discussing food insecurity and its effect on health disparities. We'll also find out about a new pilot project with the Sacramento Food Bank. Joining us today are Dr. Gerardo Mackenzie, Dr. Cassandra Nguyen, and Charlotte Kerber. Dr. Mackenzie is an associate professor and co-vice chair of the UC Davis Department of Nutrition. Dr. Nguyen is an assistant professor of cooperative extension, also for the UC Davis Department of Nutrition. And Charlotte Kerber is a PhD candidate in public health sciences in the UC Davis School of Medicine and a graduate student researcher. Thanks for joining us today.
Thank you. Thanks for having us.
Absolutely. Okay, so just to give us a kind of a baseline of the whole discussion, why is nutrition important in fighting cancer?
So nutrition is very important for cancer, both for cancer treatment as well as for cancer prevention. So if someone has been diagnosed with cancer, it's very important to have a proper nutrition, a proper diet that will help as a foundation support. To help build up the immune system, but also to prevent to fight the side effects of radiation therapy and chemotherapy. So having a proper nutrition from cancer treatment perspective is very, very important. So maybe the dietitian will let you know that maybe you need a little more protein, a little more fat, or more calories ingested just to fight those side effects from the radiation or chemotherapy. But on the other side, for cancer prevention, nutrition is very, very important because there's around 40%, between 30 and 40% of cancers that could be prevented with a better diet. There's a huge link between, for example, increased body fatness and over 10 types of different cancer types. So being able to keep that body fatness or your normal weight or being physically active or limit alcohol consumption, those are some of preventive methods that we could have trying to reduce the risk for developing cancer. So again, as I mentioned, nutrition, I think it's very important for both cancer prevention as well as cancer treatment.
We know that health disparities can affect cancer outcomes as well as even just prevention. But how do food insecurities contribute to these health disparities?
It's a really interesting question, and part of it can kind of be answered in the definition of what food insecurity actually is, because this is a term that sometimes people will hear but not always know that food insecurity refers to an experience where individuals in the household don't have access to healthy, culturally appropriate, safe and affordable food that meets their needs. And so when we think about that and we think about what Dr. Mackenzie just shared about how important nutrition is to cancer prevention as well as treatment, if an individual is not able to afford access to those healthy foods, they're not going to be able to consume the foods that are going to give them the lowest risk of experiencing cancer. So when individuals experiencing food insecurity, it really keeps them from being able to access those important nutritious food options. And so part of the contribution of food insecurity to health disparities is really explained by that connection between food insecurity and healthy food. But it also can be explained when we think about the individuals that might be experiencing food insecurity. We know that many people who are experiencing this are also employed, but oftentimes underemployed, or they have several family responsibilities that can take time or additional financial resources. And that really affects someone's ability to prepare healthy and delicious foods because you may be able to access them, but if you don't have the time to actually prepare the foods, that can also really keep you from being able to maintain a healthy diet because there are so many other priorities that people may be experiencing in their lives. So both of those things, sorry, let me repeat that. So both the limited access to healthy food as well as the limited time that many food insecure individuals experience are really drivers of these health disparities we see in chronic diseases and conditions such as cancer.
Okay, well, you mentioned culturally appropriate food options and access. What populations are the most affected by these disparities?
Well, there are a couple populations that are going to be at greater risk of experiencing food insecurity. One of those groups is individuals who have lower household incomes. And that is because with a lower income, you have less financial resources to access food, right? But despite this inextricable link between income and food insecurity, we also see these other characteristics coming up outside of income. And so we see that certain racial or ethnic groups are at higher risk of experiencing food insecurity. Specifically, we see that Hispanic-headed households, non-Hispanic Black, American Indian, Alaska Native, and Native Hawaiian and Pacific Islander communities are at some of the greatest risks for experiencing food insecurity. And that's a product of the structural and institutional barriers that they have to access healthy foods, as well as accessing very stable and well-paying jobs. And so another characteristic that can put somebody at risk of food insecurity is the household composition. So, for example, we know that households that are led by women without another partner that have children in them, that those households are at the greatest that those households are at great risk of experiencing food insecurity. And we also see that households where either an adult or child has a disability, food insecurity is also at greater likelihood there. And so connecting this back to cancer, though, we see that the cancer disparities are also linked to some of these same income or racial and ethnic characteristics of a household. But we see that when we have looked at the data, that food insecurity is really a pressing factor impacting risk, even when you control for some of these other important risk factors. And so we know that food and access to that healthy, affordable food is really this important link, regardless of a household's composition.
Outstanding. Well, that's a great segue into a pilot project that you all have with the Sacramento Food Bank. Can you just tell us about that? What does it entail, about the partnership? And then what are you seeking to understand through this pilot project and study?
Yeah, this project is exciting. Funded through the Office of Community Outreach and Engagement at the UC Davis Comprehensive Cancer Center. We're working alongside the Sacramento Food Bank and Family Services food distribution team to provide education around the importance of nutrition in terms of cancer prevention and the ways in which we can help guide them towards food choices that are offered by the food bank. So, I've been working now as a volunteer, building a nice rapport with food bank staff, but most importantly, food bank clients for almost 2 years now. This is coming in time with a project I'm doing as part of my dissertation. So I having that community trust is a really important aspect of working with partners, not just because we want to work with their clients, but because we want to make it meaningful to them. So we've collaborated along the way with the food bank leadership to help ensure that our contracts are meeting their needs, the materials we're developing are meeting their needs, and that we're collecting, their impressions on how the work we're aiming to do is feasible and meaningful. And so our pilot project will be assessing that and seeing how we can provide some of our UC Davis Comprehensive Cancer Center resources to this community.
Yeah. So building on that, again, I think like the overall objective of our work is to again develop these intervention materials based on the foods that fight cancer. There are certain foods, including like some fruits and vegetables. So we've selected some that would be present in the food bank so that the clients could see if we promote like the selection of these foods, will that have an impact on their choices, yes, at this setting. So again, we want to understand if these are small steps in this pilot study, but this could lead then eventually to a bigger study, and where we can understand better how selecting these kinds of food could have an impact in the long run. And of course, adding maybe more food banks or more distribution centers, so we can have a better understanding of a more diverse population that are being selected.
Yeah, and as we develop these materials as part of the pilot, we're referencing some known backed research food items from the American Institute for Cancer Research, foods that fight cancer. So we've worked with the food bank to identify which foods to focus on first and provide education from that list to really make sure that we're targeting evidence-based recommendations for this group of people.
What are some examples of some of the foods that are on that list?
Yeah. One of the things that I think is very common in many pantries is apples. Apples provide a lot of vitamin C. They provide fiber. Those are, great for antioxidants and also having a lot of impact on colon health. And so also really important to know what your personal risk is in terms of, is it a probable piece of evidence or a limited piece of evidence? So it's nice to be able to introduce these items and their background to clients at the food bank and give them a resource to go and learn more.
Outstanding. Well, why was the food bank selected for this pilot project?
Sacramento Food Bank and Family Services is the largest nonprofit provider of social services in Sacramento County. They began in a response to COVID-19 doing a direct food distribution service to help meet the need, and they've really become an asset to the Sacramento community and have maintained those efforts since years after our quarantine time. So working with the food bank in Sacramento as an affiliate of the UC Davis Cancer Center, which is located in Sacramento as well, I really wanted to make sure that we were providing a direct benefit to the community that is being served by the Cancer Center. So it was how I started to formulate that relationship early on. And we've been able to, over time, find a way in which we can collaborate with the food bank on different research projects in providing services for their clients. And so we're really grateful for that bidirectional partnership that we've been able to work towards in the context of community-based participatory research. You do want to have a close working relationship with the stakeholders and really understand who the experts are in this space. And so it's as much as we know the methods, it really is the staff and the clients at the food bank. So they've been so helpful in understanding how we would be able to move this project forward and create something worthwhile.
I want to add that we are really benefiting from this investment of time and energy that Charlotte Kerber has put in to build a relationship with Sacramento Food Bank and Family Services, having volunteered for so long with them, knowing their interworkings and being able to launch this pilot so quickly, as well as in a way that ensures that our interests at the UC Davis Nutrition Department are also matching the interests at Sacramento Food Bank and Family Services. And so we're really benefiting that the staff and professionals and volunteers at Sacramento Food Bank and Family Services were already interested in promoting nutrition, in promoting health, in wanting to ensure that the individuals that are being served by these pop-up distributions are not just being served any food, they're being served food that is relevant, appealing, and ultimately good for you. And so they were really interested in identifying ways. How can you promote certain foods to clients? And this is just one way that we're doing that in this project. And we're really fortunate that we're able to test these materials around foods that fight cancer, as well as to potentially explore other avenues in the future around promoting foods and identifying what resonates with clients around healthy foods that they want to pick up and select at the food distribution. So I just wanted to add that.
Excellent. Well, are all food bank clients eligible to participate in this study?
We are promoting our intervention, which is these materials focused on nutrition and foods that fight cancer, to all persons who come to the food bank. However, we're selecting some feedback from adult clients who come to the food bank. We, non-specific by gender or race. We just want to hear from anybody who is coming and willing to share that experience. We also are doing this kind of feedback collection in waves. So this quarter, we've been working on collecting qualitative feedback, or, really hearing directly from the clients and the staff at the food bank. So I'm conducting interviews with clients and getting some of that, one-on-one, hard-hitting, we like this, we don't, hands-on interaction with the material drafts that we have now. And so, again, I think that's really setting a nice stage for us to promote this in next quarter and have that heightened engagement amongst the entire food bank population, and hoping to recruit some adults to come and give us some feedback in a survey.
I just wanted also to add that many of the materials are translated into different languages. So like a lot of the, just to expand, like who is able to participate in our study. So that this is also very, very important, so we can capture the whole population that is being served, or the majority of it as well.
That's a really great point. Food Bank serves over 13 different languages, and the location we're working with in Arden Arcade happens to have a high population from Russia and Ukraine and Afghanistan. So we're working hard to make sure our materials are relevant to all folks who will be able to interact with them.
Well, how long is the pilot project expected to be active?
We're anticipating 1 year. Working with the community and having a real-time rain or shine event can sometimes change timelines for you, but we're really hoping to get a viable intervention by this summer. All things considered.
Yeah, so this is again 1 year pilot study, but again, I think we are fortunate that Charlotte has already put a lot of volunteer years into this to establish the partnership, because just by establishing the partnership and connecting, it would have taken much longer, I would say, for the whole study. So having that in place, I think for our pilot study, like 1 year is appropriate to develop and be able to analyze and educate the population.
I appreciate that, Gerardo, because I think it's also important to note that we're not just leaving at the end of this project. That's definitely not the type of relationship where we just come in, tell people what to do, and leave that we're trying to establish with Sacramento. We are continuing with this pilot in hopes of learning more to do expansions of the work we're doing. As well, I continue doing my research with this population, and in collaboration with the leadership at the food bank, we also, as a research team here, have been applying for additional funds so that we can continue to support ongoing work with them, in hopes that this is a long-term and meaningful relationship beyond just the confines of this project.
Well, and that's outstanding that your existing relationship helped to get this pilot project up and running so much faster because you already had established relationships versus starting out introducing it all and then having to begin the project. So that's wonderful. Well, does funding for something like this come from?
Yeah, so we are really fortunate that this 1-year pilot project was funded by the Comprehensive Cancer Center. And that really allows us to ask these research questions about these materials, which are these the appropriate materials to be used? Do people resonate with these messages, with the images that are being used? And does it impact the foods that they're selecting when they're picking up their items from the pop-up food distribution? And we are interested in expanding on this work with additional funding after we finish this pilot. So we may look at whether or not selecting these foods in this context makes an impact on individuals' diet as assessed by their health status or biomarkers. Additionally, we are exploring funding to support the dissemination of our results. So when we find out whether or not these materials work, and if they do, we'd really love to share that result with other charitable foods agencies across Sacramento and potentially across the state, because there are many charitable foods professionals and volunteers who are really interested in doing this, but don't necessarily know what messages are going to resonate or not. And so finding additional funding to support that dissemination of our findings is really what we're exploring now. And ultimately, we're quite fortunate here in California that we have several agencies that implement CalFresh Healthy Living, which is a program that supports healthy choices among individuals who may be eligible to receive SNAP, or as we call it here in California, CalFresh. And so their stable funding provide support for individuals who want to implement work like this. After we find great evidence-based research materials that work, they're able to then take those materials and implement them across different communities and contexts. And so we not only are looking at the funding for kind of the research and this really specific context of this pilot, but also keeping in mind, what does that funding look like for this kind of work long-term, to be sustainable and to be transferable to different contexts and communities.
Is there a way for the general public to get involved with this pilot project, or are there any specific needs that they can assist with?
That's a very good question. Yes, again, of course, like we always are looking for additional funding. So again, if there is a donor or something, then that thinks that this is I think this is a great project, but again, if there's something that they would like to donate, or it's aligned to their donation needs or donation package, I don't know how it's said. Like it's like, how is it said? Like donation.
I'd say priorities.
Priorities, yeah. So again, so if there's any possible donations, I would say, like always, as Cassandra mentioned, to disseminate the work, to ask additional questions, to have maybe additional food banks involved throughout the Sacramento region or throughout the state. Again, of course, implementing this kind of research, it will take additional resources. So if there is any alignment with donation priorities, that's always welcome.
I'd love to add that, my ability to work with the food bank wouldn't be possible without, the general public that comes and is served by the food bank. And so I really thank them for their time and participation and their patience as we are working to help support them, but really learn a lot in this process. And really another factor is the volunteers who come to the food bank. The ability to be a long-term volunteer and step away knowing there's other folks who can come, support the work outside of direct research is very important. So I want to send another big thank you to the Sacramento Food Bank Family Services staff who gives a ton of support in allowing me to show up and talk about cancer, and definitely encourage folks to come and volunteer at the food bank.
I really echo what Charlotte's communicating here is for any listeners who might not be in the Sacramento area or might not be able to volunteer with Sacramento Food Bank and Family Services, is the valuable contribution that can be made through either donations or time to local charitable food organizations. This is really valuable work in developing relationships with your neighbors and other community members that really can be done only through the support of volunteers, because charitable food organizations are completely private organizations or are really supported by local community members and local volunteers. And so I think it's an incredible experience that can be really valuable, no matter how much time or money somebody's able to donate. Any contribution can be really helpful to continue this work.
Well, and specifically for your pilot project, is there a way for potential donors or anybody that wants to get involved, whether it's time or financial resources, that they can get in contact with you specifically? Is there a website or email addresses or phone number?
Potentially, again, we have our contacts in the Department of Nutrition website for our faculty. Actually, we have not developed anything like a link or something, donate now, but again, like I think that, I don't know, maybe through the Cancer Center, or I'm sure or again, we could potentially come up with something, but yeah, again, there's definitely ways to contact us through our faculty, Department of Nutrition faculty websites, and then you can find either Cassandra or myself, or in the Cancer Center, you can find Charlotte, yes, and
the Office of Community Outreach and Engagement at the UC Davis Comprehensive Cancer Center is also a great resource to connect with in terms of their ongoing projects and outreach. And I imagine if any fiscal sponsorship is going to be supporting a project like this, they would definitely be a great asset in helping secure that for us. So please, feel free to connect with that office.
I think that any of us would be happy if folks want to reach out just to learn more about the project as well. Myself, Dr. Mackenzie, and Charlotte are more than happy to share more details about the project or have further conversations with anybody who might be interested. And both myself and Dr. Mackenzie's information is available on the UC Davis Nutrition Department website.
Outstanding. Well, and I'll be sure to include all kinds of contact information within the description of this podcast. So wherever you're listening, you can reach out if you want to donate or just find out more. One final question that I have is, Sacramento is known as the farm to fork capital. So does that make us better positioned to make advancements in reducing food insecurities that then contribute to the health disparities?
So I would say yes, yeah, definitely, because again, I think like in many aspects, like we have access to a lot of fresh fruits and vegetables throughout the region. So I think, and also like farmers are willing like to donate maybe extra to food pantries or to other places as well. So anything that maybe they're not able to sell directly. So I feel like many people would have access to fresh fruits and vegetables and easier, I would say, than in any other place. So I think like by building these networks, these partnerships, and I think many of them are established, like, and I think local farmers are very much willing to and helping like these local pantries and food banks. So I think we are Sacramento region is well positioned just because of the agriculture areas that surrounds us, and also like the great people that are here.
I'll add to that our community in Sacramento surrounding the UC Davis Medical Center is very much a great segue to link our UC Davis agriculture efforts to public health. And this project in particular certainly demonstrates that ability to show how the coordination and collaboration with our main research campus and our bench scientists, cooperative groups of extension scientists, and even myself as a student in public health school of medicine, really cross collaborating in those different areas can enhance the ability to make a big impact. And collaborating with large partners like Sacramento Food Bank really gives us a big step up in feeling able to make a difference in this community.
And I'll just add that we really benefit from our location in that we have access to so much fresh food that when fruits and vegetables are fresh, grown down the road, we have the benefit that they taste delicious. And so when eating healthy also means eating delicious foods, I think that our job as nutrition professionals and public health professionals is just that much easier, a little bit easier to make possible. And so I feel like we really benefit from that in this area.
Awesome. Well, Dr. Mackenzie, Dr. Nguyen, Charlotte, thank you so much for joining us today. It's been a pleasure talking to you and learning about your pilot project with the Sacramento Food Bank and Family Services. Thank you for tuning in and listening today. If you'd like to get in touch with us, you can email us directly at beatcancer@ucdavis.edu. Beat Cancer is a production of the UC Davis Comprehensive Cancer Center. For more information on our NCI-designated Comprehensive Cancer Center, please visit health.ucdavis.edu/cancer.